Welcome to the Medical Billing Blueprint podcast, where we break down the complexities of medical billing, revenue cycle management, and healthcare compliance. Join us as we explore strategies, tips, and industry insights to help doctors, practice managers, and medical staff optimize their billing processes and boost practice revenue. Let's get it right with the Billing Blueprint.
Hey everyone, welcome back for another deep dive. Today, we're really going to dig into something super important in healthcare cultural competence.
It's huge.
It's like you go to the doctor, right? You want to feel heard, seen, no matter who you are or where you're from.
Absolutely. Feeling understood.
Yeah.
And that's really what we're aiming for with cultural competence, creating a system where everyone feels comfortable and respected and everyone gets the best possible care, no matter their background.
Exactly. And I was reading about this actually in The Case for Culturally Competent Healthcare by Dr. Smith and Cultural Diversity and Health Disparities, a fascinating report by the National Institute of Health.
Both really great resources on this.
Super insightful, and they both really drove home this point. If you want the best health outcomes for everyone, cultural competence is non-negotiable.
Couldn't agree more. And I think sometimes people kind of brush it off like, oh yeah, be sensitive to other cultures. But it goes way deeper than that.
Yeah.
It's about recognizing that like healthcare decisions, those aren't made in a vacuum. They're influenced by a person's culture, their beliefs, their values.
Their experiences.
Exactly. And like, think about end-of-life care, right?
Mm-hmm.
That's when those cultural differences can become really, really significant.
Oh, absolutely. And I've read some heartbreaking stories where things went wrong because someone's cultural beliefs weren't taken into account.
Yeah, and that's the thing. We can't just pay lip service to this. It can literally be a matter of life or death.
It's true, and both of the sources we looked at really hammered home this point, that cultural competence goes way beyond just knowing a few facts about different cultures. Like, knowing someone's favorite spice is great, but it doesn't mean you understand their dietary needs, right?
Yeah, it's so much more than the surface level stuff.
Right. So how do we actually put this into practice in healthcare setting? What are we talking about here?
Okay, so it starts with how healthcare professionals are trained.
Yeah.
Right? It's about equipping them with the skills to understand and interact with patients from diverse backgrounds.
And are we talking about specific programs, workshops, that sort of thing?
Yeah, for sure. But it's bigger than that. It's about fostering a sense of cultural humility, this ongoing process of self-reflection, learning, being open to different perspectives.
Love that, cultural humility. Because you can't know everything about every culture, right?
No way.
Yeah.
And that's okay. It's about being aware of your own biases and being willing to say, hey, I don't know this, but I'm here to learn with you.
Right. It's about that partnership.
Exactly. Building that trust and rapport.
Which makes a world of difference because, let's be real, when you feel like your doctor really gets you, you're way more likely to actually listen to them, follow their advice.
100%. And there's research to back that up. Culturally competent care, it leads to higher patient satisfaction, better communication. Patients are more likely to stick to their treatment plans. It just makes the whole thing work better. Think about a doctor using visual aids to explain a diagnosis to someone who doesn't speak much English.
Yeah.
That kind of sensitivity can make all the difference.
That's what I'm talking about, meeting people where they are.
Exactly. And it's not just about warm and fuzzy feelings either.
Right, because this ties into something that I feel really strongly about, and that's health equity, right? Making sure everyone has a fair shot at good health.
Absolutely. And that's one of the major goals here, to eliminate those health disparities we see across different racial and ethnic groups.
Yeah, because everyone deserves the same quality of care, regardless of their background.
100%.
So this is good for patients, obviously, but it's also good for the healthcare system as a whole, right?
Oh, totally. Think about it. When staff feels valued and respected, they're more likely to stick around, Less turnover, which is huge for hospitals and clinics.
Saves money, too.
Exactly. And happier staff means better care.
It's a win-win for sure. Okay, so we've talked about how important cultural competence is in healthcare, but it makes you wonder, right? Where else could this make a difference?
Oh man, everywhere. Think about schools.
Schools, absolutely. Imagine a classroom where every student feels seen and understood.
And workplaces. Imagine that, a workplace where everyone feels comfortable bringing their whole selves to work. We're talking about better communication, better collaboration.
Better outcomes for everyone.
Exactly.
So much food for thought.
The question is, what can each of us do to encourage this? Whether it's in our own healthcare experiences, in our communities, wherever. How can we be advocates for this kind of change?
It starts with awareness and conversations like these.
That's how we move the needle.
So true. And on that note, thank you all so much for joining us for this deep dive. We hope this has given you a lot to think about. Until next time.